My name is Kyle Baltrusch. I'm a plastic surgeon in Portland, Oregon.
In terms of how long the surgery takes in the OR, what does a day of surgery look like for a breast reduction patient?
We start operations at 8:30 at some places or 8. And so we have patients come in an hour before their operation. So say 6:30. They go to the pre-op bay with a friend or loved one. They talk to anesthesia. They get an IV placed by nursing. And then we roll into the OR. The operation itself is at probably around 2.5 to 3 hours. And then patients in recovery with us for an hour or so as well. So I would say it's probably a half day.
In your surgery center, do you work with the same anesthesia team all the time? Or are they the same people over and over?
Yeah, so these operations we do outside the hospital settings. Because they are day procedures, we do them at surgery centers. We work at two main surgery centers, our own Bridgeview and then Northwest Surgical Center. And yes, we work with the same nurses, the same anesthesiologists, day in and day out. So that is a great aspect of the surgery centers.
What are the benefits we might not normally think of you working with the same people every day?
I think we learn how the team flows, how our anesthesia providers like to do things. The nurses, our scrub techs know how we like to do the operation. So they know what instruments we want and what to expect. We all have little variations in techniques. And so they know our operations very well. And then as far as recovery, we're kind of on a first name basis. We know each other. So, I would say the anesthesiologists and the nurses feel very comfortable, calling us if they have questions, preoperatively or postoperatively. And so it's much, tighter group.
I know I was surprised at one point to find out the anesthesiologist stays in there with the patient the entire time. Like they never leave.
True.
Do you
Correct.
think people
Same as
are...
the surgeon.
Yeah, both of you are there the whole time.
Yes.
It's not like set it and forget it.
Yeah.
Bye, anesthesia. See you later.
Yes.
Does that happen in the hospital or is it kind of the same everywhere?
Yeah, same everywhere. So certainly,
Yeah.
occasionally we all need breaks or, anesthesia. If it's at a hospital, they may have
Cannot go to the
may have
bathroom.
residents. And so, yeah, even another anesthesiologist will come in and give them a break, to run to the bathroom or grab something to drink. And so that's not necessarily the case with the surgeons, but, at the hospital settings, they have residents that, depending on their level, can also run rooms under the guidance of anesthesiologists. The surgery centers that we work at are just the anesthesiologists or CRNAs. And so they're in the rooms the whole time.
I had another anesthesia question. Oh, people are often really afraid of anesthesia. Do you find that happens with your patients too, that it comes up pretty often?
It does come up pretty often, whether that be, patients who are anesthesia naive or who have had multiple operations. Our anesthesiologists at these centers do call the patients the night before and talk them through their plan, ask them about their medications and let them know if they need to hold anything. But I do talk to my patients about, like the blocks that they do, and that at these surgery centers, it's not a true endotracheal intubation, certainly IV sedation, but they do laryngeal masks. And so, they occlude the airway, but there isn't a tube that is going through the vocal cords. And so, but I do, I'm not an anesthesiologist, and so I can't go into great detail of like agents or what's being used or what to expect. And I haven't even had surgery myself, so I can't tell them firsthand experience of that. And so I just tell them that the anesthesiologist is going to, call them the night before surgery and certainly ask them any questions that they have. But oftentimes, it's more the anxiety. And so patients do receive an anxiolytic if needed preoperatively after we do markings, to help them feel a little bit more comfortable and relaxed going into the operating room.
I think you're painting a picture for me of a lot of people who do their jobs really well. That's kind of what I see when you describe it.
I think we do our jobs pretty well.
Links to our guest's website and contact info are in your show notes. Follow us on Instagram at Where Before Meets After. Where Before Meets After is a production of The Axis, the podcast agency for aesthetics. THEAXIS.io.